All right, everyone. I'm going to go ahead and get started. We do have a few more people that are hopefully going to be joining us. If not, that is perfectly fine. I really want this to be kind of interactive. If you guys have any questions kind of throughout, just let me know. You can put it in the chat. You can turn on your mic. It's kind of up to you how you want it to go. But I do know most of you, but just a quick introduction. My name is Jennifer Sutton, and I own Chronic Hope Counseling. I opened Chronic Hope Counseling a little over a year ago now, I believe June, July of last year. So we're still pretty new, but we're very glad to have reached that 1 year mark. Super excited. Oh, is Dr. Barnes is still planning to attend? Oh, no, no worries. She can join us whenever she gets here. Traffic has been very weird lately. I never know if no one's going to be on the road or we're going to be jam packed. So no worries. She can join when she gets here. But yes. So let's keep going here. So a little bit about me. There's a pictures of my wonderful little family. I have my two pups, Scooby and Fen. Fen is a quarantine dog. We got him because we were stuck at home anyway, so might as well get a dog. So that's the little black-haired one there. And then my husband Ed is in these pictures as well. Tomorrow is actually our wedding anniversary, 4 years, so we're super excited. But like I said, I am the owner and one of the counselors at Chronic Hope Counseling. And also, a big part of my identity is the fact I'm a chronic pain patient as well. So, I have had chronic pain. Looking in retrospect, I have had chronic pain all of my life. I didn't really start getting significant till I was a teenager, and then kind of into my 20s, it really started getting more debilitating. But I was undiagnosed the vast majority of my life. I was finally diagnosed last year with Ehlers-Danlos syndrome. So it's a genetic disorder that affects connective tissue and collagen. So nothing quite works right, which is part of the reason it's so hard to diagnose because my knee hurts, so I go see a knee doctor. My blood pressure's weird, I go see a cardiologist, and no one kind of connected the dots. But it's my experience with pain that really got me to open Chronic Hope because I remember years ago I went to try to find a counselor and I was referred to an addictions counselor because they told me
Mm,
that was the closest thing to someone that knew about chronic pain. And I was really devastated. I'm like, I'm not on medications, I'm not addicted. That's not who I went to see. So I decided to go back to school and I wanted to really open a practice and be the resource that I wanted all those years ago. So it's really what pushed me to kind of do what I do today. Clinician. So there's me. Um, I see people of all ages. I think the youngest I've seen is probably about 14 and up has kind of been where it just happened to land, but I do see people of all ages. I do have that personal experience with chronic pain, and I accept Blue Cross Blue Shield. Um, Recently, I hired Michelle, which is my other clinician here. She's in the chronic pain community as a caregiver. So her husband and daughter have chronic pain problems, and I thought that she'd be a really good addition to the team because she gets to see this whole world from a different perspective. And a lot of times, I will have, a teenager that's struggling with pain that I work with, and she'll end up working with the parents or family, and it kind of works out pretty well. But since she was just hired, she does have immediate openings if you want to send anyone her way. And Blue Cross Blue Shield is in the works. I don't know if that means she will get it next week or 6 months from now, but it is in the works, and hopefully that will be coming through soon. Objectives for today. So, one of the big ones is I really want to discover how we can work together to better the lives of chronic pain patients. And whether you're coming from, a counseling background or a physician's background or, whatever it is, it really is a team that's needed to help this unique population because it is so complicated. Chronic pain isn't just in the body, it's not just physical. And then learn how talk therapy and other therapy techniques can improve the lives of those with chronic pain and chronic illness. I'll go into some more specific kind of modalities and things like that that have been really useful with this population. And then understand grief and chronic pain. These go together so frequently. There's grief of the person they thought they would be, of the life they wanted. There's just, it's all intertwined in there. Grief is very present majority of the time. And then learn to identify clients who might need mental health support. I know a lot of times we don't sit with our clients or our patients for too long, and it's hard to really get a good idea of what kind of help they need. So I kind of break it down and try to make it a little bit easier to decide that and decide who to send where. Right. Types of pain. So in my world, there's really two types of pain. We have primary pain, secondary pain. Primary pain is that tissue damage. It is a broken leg, a sprained ankle. It's the physical medical side of pain. And this is what you're going to see the doctors for and the physicians for, and they're really great at that. That's what they're trained for. And then there's secondary pain, and this is kind of more where the mental health side comes in. Secondary pain is all of the emotion, the anxiety, the depression, the grief, everything that comes along with long-term pain. And the thing is with primary pain and secondary pain is they are very intertwined, right? So they are a ball of yarn that you found in your basement from 10 years ago. It is impossible or very difficult to get it back into something you can work with. And that's one of the big goals with chronic pain counseling. It is to identify and separate these two pains. So the goal is, by really identifying what is a primary pain and what is a secondary pain, we can start really lessening that secondary pain, working on that negative reactivity that happens when we feel a symptom or a pain surge that can really make it so much worse. Because with me, just personally, a lot of my pain comes from muscle spasms. When you're stressed, you tense, and that makes everything so much worse. So just in the simplest way, I need to recognize when my stress happens, what pain is coming from that stress, and what pain is coming from a muscle just trying its best to hold a joint together, which is more of the primary pain. All right, so I'm going to tell two different stories here. Both of these stories have an injury that happens in them, both the same injury. Now we're going to try to decipher which story is going to have the most pain associated with it, okay? Story A. It is a beautiful, wonderful, sunny day. You got a promotion at work you have been working for forever. You get home and it is date night and you are ready to go out. You're so excited. And as you're running around getting ready to go out for the night, like bam, you hit your toe, you stub your toe. Okay. Story A. Story B. Gloomy, rainy day. You get looked over for a promotion at work. It is pouring and you forget your umbrella. And you finally get home and realize no food. You did not plan dinner. So you get a frozen pizza, you put it in the oven, forget about it. And you are reminded of that pizza by your fire alarm going off. And as you are running to get that pizza, bam, you stub your toe the exact same place, the exact same way. You're going to experience that pain very differently, right? And I bet you anything, scenario B, you're going to say some colorful words, you are going to be frustrated, it's going to be annoying. And story A, honestly, you might not even feel it, right? And this is just such a beautiful, clear example of how your mental state affects how you process pain. So if we get clients in a better mental place, pain is processed completely differently. And that's a big thing we focus on with counseling as well. All right. So there's something called the gate control theory, which I don't think I actually put anywhere on this slide, but it's called the gate control theory. So this theory is trying to explain the phenomenon of pain tolerance. right? If I go up and I flick two people the same way,
Mhm.
why are they going to experience that differently? Why is pain so subjective? So this theory says that we have this little gate, right, on kind of like the top of our spinal cord. And when this gate is open, the pain just flows. All the pain signal goes to the brain. It's all processed. We feel everything. When it's closed, it stops those signals. We don't necessarily get all of the pain and all of the pain signals going to our brain. So the question is, how the heck do we control this gate? We want it closed when it's open. So some of the things that it suggests that opens this gate and really increases pain and lets those pain signals through is muscle tension, drug abuse, attention to the pain, thoughts about pain as an uncontrollable thing, beliefs about pain as a mysterious force, depression, anger, anxiety, too much or even too little activity, poor diet, and other kind of health behaviors, then little support from family or friends. So those are the things that's going to really increase the pain we feel. So what are some things that's going to close this gate? Drugs. We're talking good drugs. We're talking medications, appropriate medications. Surgeries to fix something, right? If you have appendicitis, you take that appendix out, that's probably going to start feeling a little better, right?
Mhm.
Reduce muscle tension, distraction or external focus from the pain, thoughts of control over pain, beliefs of pain as a predictable and manageable thing, emotional stability, relaxation with a calm and positive mood, appropriate pacing of activities, positive health habits, and support from others. So, good news is we can control a lot of these things, right? We can work on a lot of these things. They're not things out there that we are grasping for in the dark that we can't get. And one of the big places I really start with a lot of clients is thoughts of control over pain and the thought of pain as a mysterious force, right? So a lot of my clients, I start with a little pain science. What is pain? Where does it come from? What is your pain cycle? What do you get stuck in? And just doing some of this psychoeducation can make this pain not seem so mysterious and scary. All right, so I'm going to attempt to play this video. If there's feedback or something like that, please let me know. I had luck with it this morning. So this is an introduction to central sensitization, which we'll go into a little bit more after the video. But here we go.
Once upon a time, all the lands were fraught with persistent pain. So widespread was this affliction that 1 in 4 people experienced it. The pain lasted for more than 3 months. It shadowed their daily lives, held them back from everyday activities, and the interventions they tried proved useless. Hey, pain, go away, we've tried it all, but still you stay. Moving less, taking pills, knives and needles, and still we're sore. We can't take no more, no more. But the pain remains like a loyal companion. The people's hopes faded, and they became resigned to living with the pain. Only now the pain was a beast. Then along came a group of researchers, of which I am one. Back off, big fella. I'm Professor Lorimer Mosley, and I'm a pain scientist. Pain scientists are starting to think differently about pain and its causes, and we're making exciting discoveries, like how the way you think about your pain can change the way it feels. Over the next few minutes, I'll help you to understand your pain. Understanding is important because it can change how much things hurt and how much your body can do, and it can help you to tame the beast. First, trust me about this. Pain is not an accurate measure of tissue health. Pain is a protector. By making unpleasant feelings, your brain changes your behaviour so you can avoid injury or your tissues can heal. Sometimes pain is not helpful, like phantom limb pain. You don't expect a missing limb to ache, but it does, and the pain is very real. So how do we explain this? Well, pain is a warning signal from your brain that depends on credible evidence to say your body needs protecting. Sometimes pain's too protective and you get unnecessary warning signals. Pain scientists now understand that there are many ways our nervous system ends up producing unnecessary warning signals. Take conditioning, for example. You think of Pavlov's dog. Every time food was offered, Pavlov rang a bell. Of course, the dog would salivate seeing the food. This went on for a while. Eventually, the dog was conditioned to salivate for the bell alone. Conditioning is just one of the ways your body learns pain. And the longer your nervous system produces pain, the better it gets at producing it. Your body learns pain. So what feeds this beast? Well, let's look at how pain works. In your body's tissues, there are specific neurons, which normally only respond to harmful stimuli, whether mechanical, chemical, or thermal. When they are activated, they send a warning signal to your spinal cord, which can in turn send a signal to your brain. This activity in neurons is called nociception, and it's happening all the time, but only sometimes results in pain. Most of the time, the brain protects you with other things, like movement. Once the warning signal reaches the brain makes sense of it based on the information arriving and a vast amount of information already stored. If there's good reason to think protection is required, then your brain makes pain. One of our amazing discoveries is that you can have pain without any physical stimuli. Thoughts and places might activate the warning signals, and the pain feels exactly the same. It's not just your brain. Your spinal cord also learns how to generate unnecessary warning signals. So how do you know when your nervous system is learning pain? You may notice your pain spreads or comes on without warning. Your body feels odd and it's hard to move properly. Your pain changes quickly with your mood and small annoyances can set it off. Old injuries start to hurt again. You're more sensitive to stimuli, and the longer the pain goes on, the more all of this occurs. The old way we understood pain could not explain these things and left many sufferers feeling like no one believed it was real, or for it to hurt so badly, there must be a major tissue problem. But we now know how persistent pain happens. So how can you tame the beast? Pain is a very personal thing. There's no one-size-fits-all solution. And while you probably have well thought out coping strategies, it's time to take a new approach to dealing with and reducing your pain, one that focuses on retraining your pain system. This might mean testing yourself physically and moving more than you normally would. Being honest about your current attitudes and beliefs can also help, as can asking your health professional new questions.
How do I know if my pain system is being overprotective?
How do I retrain my pain system to be less protective?
How do I know if I'm safe to move?
So be brave and have hope, because it is possible to tame the beast. Visit our website for more information. And
All right. So that is just a short video kind of about central sensitization. I didn't call it that in this video, but pretty much what it is it is an overreactive nervous system. Right? It's gotten so sensitive and so protective that even someone coming up and poking you can hurt because your brain is telling you that that is something that is dangerous. Let's see. So here are some common terms with central sensitization. Forgive me if I butcher these words. I believe I'm close. Whether I'm accurate, I do not know. So first is allodynia, which is when a person experiences pain with something that's not normally painful. That's someone coming up and poking, and that just causing intense pain. I know I definitely struggle with this, and sometimes just like my husband coming up and rubbing my arm or my dog brushing against me can hurt. And I know like those aren't dangerous, right? It doesn't mean my nervous system knows that, and it will send off a signal sometimes. And then hyperalgesia, which is when something that is typically seen as painful is perceived as more painful than it should be. So my example of this is before I was diagnosed, before we really knew what was going on, my physical therapist wanted to do dry needling. Then I'm like, okay, that sounds awful, but let's do it. It's pretty much like a deep muscle acupuncture. It's supposed to release trigger points. And obviously I knew this was not going to be comfortable. It's never comfortable, right, to get needles jabbed into tender parts of your body. But it was so painful to me that I really kind of startled my physical therapist because I started just like sobbing. Like it hurt so much. And I was out of work for like 3 days. It really made no sense. That was not an appropriate reaction to that at all. And my poor PT, I really loved this PT, but I scared him, unfortunately. But it was just my body freaking out. It did not like that foreign objects going into my body. This can also cause light, sounds, and smell sensitivity. I know for me, and oddly enough, for a lot of chronic pain patients I know, we cannot step into Walmart. Something about Walmart in particular, those lights just set off headaches so quickly. And once again, I tell my body that doesn't like to listen to me, like, it's just lights, it's okay. But it still causes problems because my body's overreacting. And this can also mess with emotional regulation and cognition. The nervous system is tangled up in everything in your body. And I don't know if y'all have heard the term brain fog before, but it's a very common thing people with chronic pain have. And it's just as the name describes. It's like looking through fog, trying to perceive through fog. It's cognition gets slow, speech often gets really slow. My description of this to my husband is always, my brain is full of spider webs. Like that's what it feels like to me specifically. And all of this is just my nervous system not dealing with stimuli appropriately. So good news is they have some research on how to calm down central sensitization. So the number one thing that's been researched with this and found positive results is cognitive behavioral therapy. So I'm sure most of you know it's a talk therapy that really kind of focuses on changing unhelpful thought patterns and challenging anxious thoughts and challenging distorted thoughts. And all of that is great for chronic pain because we get in our own heads for sure. And one of the big things we do is decatastrophizing. A lot of times with chronic pain or illness, especially when it's not diagnosed, we feel a new symptom, panic. Like that panic sets in, that depression sets in. We're like, oh my God, this is going to be here forever. Then you go to Google and you go down the nice rabbit hole of Dr. Google. And next thing you know, like you think you're going to have to just cut off that limb. And that's not a helpful place to go. I feel like one thing I work on with a lot of patients is what is productive Googling? What is unproductive Googling? Are you looking up something that is going to help your mental state? Or are you going to end up worse than where you started? So decatastrophizing is really looking at your patterns, looking at your fact that you blow things up with anxiety and really challenging that. And I created a decatastrophizing health anxiety worksheet a while back that kind of walk people through step by step of like analyzing everything about a situation and kind of calming down these terrible anxiety thoughts. If you want that worksheet, let me know. I'll send it your way. And then challenging anxious thoughts. Yeah, I'll send that your way. So challenging anxious thoughts, right? I think something that a lot of people have this incorrect theory on is if they think or feel something, it's true. Bam, they go with it. They're like, I'm anxious, I must be anxious. I'm going to be anxious. And that's not necessarily true. We can challenge that, right? If you're anxious, think why. Is it appropriate to be anxious? Is this a productive anxiety? If not, let's try to think of a different way to reframe it. And same with cognitive distortions. Is what you're thinking and feeling productive? Is it going to help? If not, let's try to find a different way to think about it. And then changing the way they talk to their pain. This is always a weird one when I throw it out there. So I found with people with pain, we have a self-talk and we have a talk to our pain. Self-talk is, oh, how am I going to get through this? This happens all the time. What's this going to look like 5 years from now? Our talk to our pain is, why do you keep doing this to me? You stop me every time I try to do something. And we have two separate things. We have an I and a you going on. So we really think about that talk to our pain and analyze that. Because most people don't even realize they're talking to their pain. It's very passive most of the time. So we say, hey, Are you saying productive, helpful things? Or are you saying really damaging things? Because we believe ourselves. So if we tell ourselves horrible, anxiety-producing thoughts all day long, we're going to start believing them. So really challenging those both with self-talk and with talk to that pain. All right, mindfulness and meditation. I feel like I have two types of clients come into me. One, mindfulness and meditation is awesome. I think it's cool. I want to try it. The second half, that's the stupidest thing I've ever heard. I don't ever want to do that. I tried it once for 5 minutes and couldn't do it. I respect both of those opinions. And if they like it, then we find ways to incorporate it. If they don't, I wait a little while and then I bring it up again. Because I do find that this is so, so helpful for a person in general, but especially someone that's dealing with pain. So meditation gets you to sit with your pain in a peaceful, controlled environment. And first of all, people hate sitting with their pain. They want to distract themselves. They want to always be doing something so they don't have to sit with that. But if they can sit with it in a controlled, peaceful environment, they can observe it with less emotion, more objectively. And they get to really know that pain and understand it in a different way, right? And this also helps calm the nervous system. You get more control over your nervous system the more you meditate, which helps that central sensitization. And mindfulness, also very important with people with chronic pain. So I had this person tell me a while back, which really kind of changed my perspective on mindfulness and pain, is a lot of secondary pain with chronic pain and chronic illness patients is fear. Fear of the future. Fear of what's this going to look like 5 years down the road? What is this going to look like tomorrow? And if you are truly mindful and you are in the moment, it's impossible to fear. It's impossible to fear the future because you're so in the moment. So really practicing this mindfulness can be so, so powerful. And noticing that a lot of times we see pain as like a rock we hit. We hit this rock and that's pain. But it's really more like water. It's very fluid. From moment to moment, it changes and it morphs and it just never really stays the same. And both mindfulness and meditation can get you to observe these minute differences, which might not make it seem so rock hard scary. If this changes all the time, maybe it can change for the better, right? And that's a really powerful mindset to have with this. All right, chronic pain and grief. Very few people come into me and say, I'm grieving over my chronic pain. Most of them are angry, frustrated, sad, but it's never really recognized as grief. And I think it's because in our head, we have a very strict idea of grief. We lose someone, we grieve. We lose something, we lose a job or something, maybe we grieve, maybe not. But chronic pain and grief, that's not really recognized, right? You start grieving the healthy life you wanted and the healthy person you thought you would be. People aren't showing up at your doorstep with casseroles and flowers. It just doesn't work that way.
Or realizing you can't have kids now.
Absolutely. Absolutely. And on a more personal level, that's where I am right now. I found out my diagnosis is genetic. I have a 50% chance of having a very sick kid. I'm not rolling those dice. And that's also an unacceptable reason in society not to have children, right? Because I remember I was looking for some sort of support group. And I'm like, I can't really go to the infertility support groups because then they'll come back at me, well, you can have kids. It's not the same thing, right? So just trying to find a place for these people to put this grief and an acceptable way to express it.
Well, or even if you can have kids and you don't have anything you're going to pass on, but you don't have the physical ability to care for them like you thought you could, or have the career that you thought you could because it requires you to be on your feet all day long, or something like that, your dream job, things of that nature.
Absolutely. Yeah, I have every single one of those. I get them.
Yeah.
Yeah, because then my husband and I are like, hey, let's adopt. And I'm like, I don't know if I can't walk my dog consistently, right? And then, I opened Chronic Hope about a year ago, and I hit my limit of clients like a brick wall. Like, I'm like, I can't do more than this. I just can't. And all of that is grief. It doesn't come in the typical ways you expect it to. You can't take time off work because you're grieving something like this. It's just not accepted. And it's also ongoing, right? So let's say you lose someone. Every day you wake up from the day you lost them, you're a little farther away from that grief incident. Whether you're getting better every day, I don't know, but you're getting farther away. With chronic pain, you wake up in that grief every morning. There's no distinct event you can separate yourself from. And that makes it very complicated because you are grieving while something is going on, while it's continuous. And I always kind of think of like PTSD, post-traumatic stress disorder. You have to be out of it, right? It has to be post. And so a lot of people that are dealing with this trauma and this grief every single day, there's not really a category or place to put them. And there's not even really good diagnoses in the DSM-5 for someone experiencing something like this, which also kind of brings up a lot to be questioned. But that's not my place, I guess. And a big part of this process is getting a client to recognize this is grief. I've had people fight me on it. They're like, no, I'm just mad. I'm like, well, what are you mad at? I'm mad I can't do things. But what are you mad at? Are you mad at this, third party pain? Are you mad at someone that didn't believe your pain? Like, what are you mad at? And they're like, I'm mad I can't do what I used to do. I'm like, honey, that's grief. And a lot of them, once it clicks, are like, I am there. It's grief. And I am a grief certified counselor, once I realized this was going on. And it was interesting because I took this whole grief certification thing and none of this was really brought up. It was all loss of a loved one and loss of this. So me being the person I am asked tons of questions. Is it related to chronic pain? And turns it into the seminar that I wanted that no one else probably did. But I got a lot of good answers and good ways to really guide clients through this, because the whole, I don't remember, 4 or 5 stages of grief that's so well known, the science doesn't support that anymore. That's not the theory. The kind of theory now is we have like a grief self and then we have an acceptance self, and we are always oscillating. So we're never going to completely fall into acceptance, which is a lot harder than one day I'm going to hit acceptance and move on. So it kind of takes away some of the hope, I feel like, when I bring clients into sessions and they're like, I want to hit acceptance. And I'm like, we'll hit it. We might hit it back a little bit, but we will hit it. We will get there. But I find grief in almost every single client that I work with. So see if we have time here. Yeah, we have time. So isolation, chronic pain and isolation go together. It is a very isolating thing. For one, a lot of these people are too sick to get out and meet people. They can't go to social events the same way. They can't really connect with people the same way. And it's really hard to find someone who truly understands what they're going through. And I've had tons of clients that come to me for intake, and at the end, there's like, I've never had someone with chronic pain to sit down and talk to me. And imagine that. Imagine you're going through something that's so powerful that it affects every decision you make, and you've never met anyone who's gone through the same thing. That's devastatingly lonely. And one of the goals that we have, just kind of with Chronic Hope, is to create a community of people that can talk, that, know each other, that really understand. And we did this a lot more when we could meet in person, but like once a month, we would do community connection events. We would have a game night, a cookout, something just to bring these people together to talk. And now we still have our free support group where we bring people together. We have a chronic pain discussion forum on our Facebook where anyone can come in and talk. And it's just kind of trying to connect people with this unique struggle. So here's
Have you heard of Colorblind Zebra on Facebook?
Mm-mm.
Look it up. It's an excellent forum. It's by somebody who has a chronic illness, and every day she posts different information about, especially the hidden, the non-observable diagnoses, and she talks about them, and it's a forum where people talk and they find that information. One of my clients, my chronic clients, also introduced it to me and found it was the first forum they found, or first anything they found that they felt like actually understood them, because they have Ehlers Danlos. Sorry, I mess that up every time, but anyway, without reading it, but and you saw how long it took you to get diagnosed, and it did them as well, along with POTS and all these other unknowns or complex.
I got all of them. Yeah.
Yes. And so there's actually a posting today about POTS. So it's to bring awareness. Stuff, it's a great one as well. So you might want to link in with them. The lady's really good response. Absolutely. And stuff like that. But and then you said, one of the other thing I was going to say was the isolation. It goes with the grief too, because like if they had friends and now they can't guarantee that they're going to make the plans to go to the movies and sit and watch a movie on Friday, because they don't know how they're, like with POTS, you don't know how you're going to wake up.
Exactly.
And so then their friends are like, you keep dropping us. And so so there's that piece too, that even if they had a network or even network of family, a lot of times they lose that because people can't count on them, or they think other things.
Absolutely. Yeah. And so many people have lost friends, and they really find the good ones, though. A lot of them really find the good ones. And what you were saying with not knowing how you feel when you wake up, I feel like I really have to work with a lot of clients on how to create goals. Because you have to create goals differently when you're chronically ill than you do when you're healthy. And when I was healthy, I would create a goal like, I'm going to go walk 3 times a week for a mile. And there was really no excuse not to do that if that was my goal. Now, if I was going to make a similar goal, it would be, when you feel well enough, walk as far as you can. Like, it's just different. And if I kept setting goals like a healthy person, it would crush me. It is just, which goes into that depression as well. Like, why can't I meet any goals I set for myself?
How do you help them when, like, I have a lot of them that will say, okay, if I have a good day, whatever that means for them, and do I push myself and do all the things that I really want to do? You're talking about that pacing yourself. But then I pay for it for 3 days. Or how do I make my family understand I want to just sit back and relax? Yes, it looks like I'm doing the same thing, but this time I'm doing it without pain.
Absolutely. And I preach pacing like crazy. And I always preface this with, this is personally my hardest part of chronic pain. I push. And I get people to be very, very mindful of their body and learn their warning signs. What is your warning sign 10 minutes before you're going to crash? What is your warning sign 20 minutes before you crash? Because we need to learn to stop before you hit that. And because the instinct absolutely is, I've been putting off all these things for weeks, I want to go do them all. And then you end up right back where you started. And I kind of try to put it in the perspective. Like, if we're just looking at a day in pacing, I'm like, you have a list. Okay, you get it done, it's 100%. Let's say you push, do 80%, then crash. You could do that. Or you could possibly get 100% done by doing 15%, then resting, then 15%, then resting. And in the end, you actually end up getting more done a lot of the times if you do respect what your body is saying. And then I really promote getting things around the house that support your limitations. Because so many people are like, I don't want to get that garden chair. I don't want to get this mobility aid because it's accepting that I can't do it. And I'm like, it may be accepting you can't do it how it is, But if you get this, you can do it again, right? Like I have a foldable, just like bar stool that I bring out to my counter and sit in when I cook because I can't stand for that long. Right? I have a garden chair I sit in so I can pull weeds because I can't bend over. But if I didn't have those things, I couldn't do it at all. So listening to your body, getting the things you need and making the appropriate arrangements to make your life as easy as you can. Buy those ugly orthopedic shoes, do what you need to do. And I feel like we have to get people to a certain level of acceptance before those things start happening. 'Cause people fight. I mean, it's human instincts and it's gotten us a long way evolutionarily, but personally, you don't always have to fight, right? What you were saying with resting, I have days where, outside looking in, you wouldn't tell I'm having a good day. But my God, I am watching TV comfortably. And that's a win as well. Wins don't always look like wins from the outside. Good, so I'm gonna play this video about isolation, and we'll talk a little bit more about it. Oh, no, I'm not. I'm gonna go back. Now I'm gonna click it. Okay.
Our planet may be more connected than ever, but loneliness has doubled in America since the 80s, with more than 40% of adults saying they are lonely. So, should you be worried if you feel the same? Can loneliness kill you? Loneliness is a psychological mechanism designed to motivate you to seek out social interactions, but it's highly subjective. In other words, if you feel lonely, then you are lonely. And it doesn't necessarily mean you're a loner or have no friends. It just means that the social interactions that are necessary to you are not being met. We often think of loneliness as something that affects the elderly, but a recent study found that young people aged 16 to 24 felt lonely more than any other group of adults. In one painful study, scientists found that being lonely made cold symptoms worse. Hundreds of healthy people completed a loneliness scale test and then were given nasal drops containing the common cold virus. Ugh. At this point, these poor, sick-induced participants were quarantined in hotel rooms for 5 days, and those who reported being more lonely prior to the test also reported more significant cold symptoms. Have you ever noticed that food tastes better when you're hungry? Scientists have actually seen the same phenomenon with loneliness. When hooked up to fMRI machines and shown either an image of a loved one or a stranger, those who tested higher on the UCLA loneliness scale showed a bigger response in the reward system of the brain when shown a picture of a loved one, while those who were not very lonely had a similar response between the loved one and stranger. This helps us see that it's not that lonely individuals lack close relationships, but rather that they long for greater social interaction. Chronic loneliness can also change your body on a cellular level. Research has found that lonely people have 209 different gene expressions in some of their white blood cells, including increased activity of pro-inflammatory transcription factor. Now, inflammation is an important response to injury, but chronic inflammation wreaks havoc on your body. As a result, we see that poor social relationships show a 29% increase in coronary heart disease and 32% increase of a stroke. Overall, people with strong social relationships have a 50% increased likelihood of survival overall. That means they are much less likely to die over the same period of time, making loneliness as deadly of a risk factor as smoking 15 cigarettes a day, lack of exercise, or obesity. So yes, loneliness can increase your chance of death. And the increased number of lonely people may be related to shifts in our culture. Global capitalism and its focus on the individual has changed our ability to access social connection. If you're feeling lonely, know that you're, well, not alone. It isn't usually a reflection of your likability, and one small step you can make today to feel more connected, try to make more intentional eye contact, whether with those you know or even a passerby on the street. Studies have found that eye contact is a gesture that makes both parties involved feel more in touch with humankind. If you guys don't already know, we actually just relaunched the Greg and Mitch.
All right. So, with chronic pain and illness patients, we have grief, we have anxiety a lot of times, thought patterns not going the right way. We have loneliness, which, as you can see, can make physical symptoms even worse. It's a really bad combination of things that makes you think that almost anyone with chronic pain could use some sort of mental health support. Personally, I'm biased and I think everybody could use some mental health support, but this population for sure. All right. So who do you refer? Who do you send for mental health support? Patients who come in frequently complaining of pain. Do they come in all the time saying things hurt? So, there we go. If so, might be time to get them some mental health support. Patients struggling to find a diagnosis. Like I said, I was undiagnosed for over a decade. The mental struggle of not knowing what's wrong with you is devastating because all of a sudden, am I sick? Am I exaggerating? If the doctors can't figure it out, then I must be fine. And that's very harmful thoughts. And almost anyone that's struggling and undiagnosed probably could use some mental health support. Patients with chronic diagnoses, anyone with chronic pain and chronic illness, there's definitely some definitely some secondary pain mixed in there. There's emotions that come with pain, of course. And then patients with unmanaged or undermanaged pain. We've had a shift in the way pain medications are prescribed. Good for some people, not too good for other people. A lot of people's pains is undermanaged right now. And chronic pain therapy, when used appropriately, can lessen pain, can work as a pain medication if done right. Right? We could really decrease that secondary pain, then we start seeing that primary pain go down as well. There's central sensitization. Their nervous system is so out of whack that they're feeling so much more pain than they need to be feeling, and calm that down as well. I did a whole talk once on how mental or chronic pain therapy can minimize the risk of opioid addiction. And it's because we're helping control the pain in a different way. All right, so some things just coming up at Chronic Hope that maybe you can refer people to if it seems appropriate. We have, the way this works is when we have 6 to 7 people kind of sign up for one of these groups, we'll start them. And we already have a time reserved for each of them. So right now, these are actively registering. One is just a weekly group therapy. This is with Michelle. This is not very structured. People come in with whatever's on their heart, whatever's on their mind, work through it, meet people, process it. Everything is through Zoom right now, so these are on Zoom as well. Excuse me. Then we have a sick and grieving course. This is much more structured. This is a 10-week course that can really help people discover, process, and start moving forward in their grieving process when it comes to chronic pain. Right, we have a free monthly support group the second Tuesday of every month. We had one yesterday. This is the flyer from yesterday. So usually we have some sort of topic or some sort of guest speaker come in that we kind of focus on. And that usually takes up most of the time. Then at the end, we kind of have, is anything on your mind, anything you want to bring up? And we have some really good discussions on these. Yesterday was learning how to own and share your chronic pain story. It's difficult for a lot of people. Where do I start? Where do I finish? I'm not finished with the story. How do I finish it? So I also have a worksheet I made that I used with this that help people piece together their chronic pain story. And the way I kind of put it together was my chronic pain story elevator pitch, right? What is it in a nutshell? What's going on? How do you express everything you need to express in just a few sentences? And I can share that as well. All right, and this is more for you guys. On October 20th through Zoom, again, wonderful Zoom, hosting a networking event. It says for mental health professionals, but all are welcome. This is really to help, build your referral network. You'll also get to meet Michelle and my marketing intern who will be there as well, and just really get to meet people in a similar profession in the area. Working together, how can we work together? So I am more than happy to send brochures, business cards. I have a whole bunch of material. I have a brochure just on chronic pain and grieving, one on central sensitization, one on our services. I have a bunch of different stuff. I can mail them to you. I can drop them off. Just let me know if you want them. Then I can do groups in your office. So if you have a group space and you have a certain amount of clients that you feel like would benefit from some sort of group or group therapy, I can come to your office and we can do it that way. We also offer free 15-minute consultations. So if you have a client or patient that's not too sure, we can talk to them a little bit over Zoom, over the phone, and just see if we're a good match. See if there's something we can help them with. And lastly, that is our fax number. You can always fax in referrals as well. And this is all of my contact information. I think I'm pretty easy to reach. I love my computer, and my email is also on my phone, which I lose my phone all the time, but most of the time I know where my computer is. But you may always reach out to me. If I can help you in any way, just let me know. And I just wanted to see if anybody had any questions here. No? I answered all the questions about chronic pain counseling in 54 minutes. That's pretty impressive for me. All right, guys, I believe I have everyone's contact information here. I have everyone's email. I've talked to all of you in some sort of fashion. But if there's no questions, you guys are free to go. I have recorded this session for the people who couldn't make it. So it'll probably pop up somewhere soon if you wanted to review it or anything like that.
Hey, I have a question real quick. About the Zebra website that someone mentioned earlier. What was that website?
It's on Facebook. It's a connection. They may have just, I don't know if there's actually a website. It's called Colorblind Zebra.
Okay, thank you so much. I'm sorry, I'm not sharing my camera right now. I'm an outpatient therapist in the area, and I've got several patients that I work with who they're uninsured, so they don't really have money to go to someone who specialized like you all, chronic pain. So I'm just trying to gather as much information as I can and learn as much to help them, navigate it. But I'll definitely share. I encouraged a couple of them to go to the group yesterday, and hopefully they'll return also, and I can encourage others to do that as well.
Yeah, that'd be great. And our more structured groups start at like $25, and if that doesn't work for them, they can still reach out. We can probably work something out. So always encourage them to contact us, and we can see if we can figure something out for them.
Well, I see so much grief with it that I don't think they are realizing it's grief at the moment. Like men who have back pain, who are just so angry.
Yeah, anger, especially with men. I feel like a lot of the men that come to me, they just come with so much anger, and I really try to get them to figure out what they're angry at, because a lot of times they don't know. It's just so much anger.
Well, anger is the opposite of vulnerable, right? It's the barking back. It's and that's like the male persona, right? I've got to fight. I've got to, and of course, boys are taught they can be angry, but they can't cry. And this feeds right into that so much. But even my female clients, it's like, I can be angry at this, or I can be angry that the doctors haven't figured this out. And even scared sometimes comes out as anger. So it's a power emotion when we feel so vulnerable.
Yes,
absolutely.
So we're trying to counteract that vulnerability.
Yeah, I usually try to get those clients to journal about that anger if they're open to it, or record themselves talking, because a lot of times they'll open up to themselves way before they'll open up to me. So I try to get them to do that, because some hate writing, and I'm like, next time you're angry, just record your thought process. Tell me what you're thinking. And sometimes that can be helpful.
Okay, thank you so much. Well, I'll definitely, this is not the end of me interacting with y'all. Don't worry.
Good.
Thank you.
You're welcome.
Thanks for hosting this, and I hope you do something else again in the future.
Yes,
Or
I'm planning to, hopefully. So I'll keep you
and
all updated.
I'm
Mhm.
actually really glad that you said that you might be willing to do a group in my location, because you're up in Raleigh and I'm down in Apex.
Mhm.
I have a lot of clients that come from even, south of here or whatever that is geographically. And so coming to here is far enough,
Mhm.
but they might convene
Yeah.
in my office, and so I might look at that for the future. So would that be like post-COVID kind of thing?
Yeah, probably. We could also do something together. I know we've talked about that in the past. You could co-run something, or just whatever
Sure.
really works. Because I've talked to some physical therapists about that as well. Because I know a lot of people are more comfortable
Yes.
going to a physical therapist office than they are to my counseling office. So I've talked to some therapists, in depth for about coming to their office and doing groups with people there, because that's much
That's a
more
neat
comfortable
idea.
for people. So yeah, that's pretty open. And we could also do Zoom things. I'm having a hard time getting people to sign up for Zoom groups. People are tired of Zoom.
Yeah.
So,
Well, I'll definitely keep that up in mind. I think more for post-COVID,
yeah.
because that's what a lot of my people have shown interest in your groups, but can't make it up that way.
Yeah.
So if I kind of talk it up over the next few
Mhm.
months, maybe. Thank you. I like that.
Yeah, absolutely. Sure.
All right. See ya.
All right, bye. Thank you.
Hey Jennifer, just wanted to say thanks for hosting. I found your information super beneficial. I have a lot of patients that have chronic pain, so I will definitely be referring them to some of your support groups because most of them are uninsured. So
Yeah, I completely get that. And we do have like sliding scale and such for
Okay.
uninsured. If they can afford, $60 or $50 a session,
Great.
we can usually get them in. And I'm not sure where your office is, but I can definitely drop off some brochures and stuff if you think that would help kind of encourage people.
yeah, you're more than welcome to. It's going to be out of your way. I work at the free clinic in Bowie's Creek, based out of Campbell University.
Okay.
So
Yeah.
it's probably about an hour from you, but if you have like a PDF you could send me, I can print them off.
Yeah, absolutely. I will send it to your email.
Perfect. Thank you so much. And thanks for hosting again.
You're very welcome.